Hey everyone! So today I'm going to be talking about a recent treatment method that has been developed for OCD. But before we can do that, it is important to understand what OCD is. So OCD is now a standalone category of disorders in the DSM that usually consists of two dimensions. So the first dimension of OCD is the obsession dimension. Obsessions are mental intrusions such as obsessive thoughts that a person will experience that causes them to feel anxiety. So the second dimension of OCD is the compulsion dimension. Compulsions are the physical actions that a person will act on in order to relieve their anxiety. So common types of compulsions can include compulsive cleaning and compulsive checking. When it comes to treatment methods, practitioners have tried using medications as treatments for OCD, but have found better results using cognitive behavioral therapy, or CBT for short. So cognitive behavioral therapy is a treatment method that works to treat the two dimensions that plague individuals with OCD. The cognitive therapy portion of cognitive behavioral therapy works to target the obsession dimension of OCD. The behavioral therapy portion of cognitive behavioral therapy works to target the compulsion dimension of OCD. So families can be involved in perpetuating OCD symptoms through family accommodation, or FA. Family accommodation is a loved one's unintentional attempt to ease the anxiety of their loved one by accommodating their compulsions. This can be done through reassurance or assisting in the compulsions themselves. What research has shown is that upwards of 98% of families have accommodated OCD symptoms at least once a week, either through tolerating OCD behaviors, reassurance, or routine adjustment. But what researchers have failed to take into consideration is that as we age, our sense of family changes in order to include intimate partners. This realization gave rise to a new treatment method for what we now call couples-based cognitive behavioral therapy, or CBCBT for short. So CBCBT works through providing psychoeducation to both partners about OCD symptoms and family accommodation. It also provides a general couples therapy to strengthen the existing relationship between both partners. And most importantly, partner-assisted exposure therapy. So partner-assisted exposure therapy is when the partner is trained in being an effective support system for the partner who is experiencing the exposure portion of behavioral therapy. The partner assists by guiding the person through their anxiety and not allowing them to participate in their compulsions. The ultimate goal is to provide the individual with a supportive platform in order to decrease their anxiety to a manageable level without participating in behavior. What international research has shown is that this treatment method is not only effective in both decreasing OCD and family accommodation symptoms, but has seen as having helped the individual sustain their progress over a longer period of time.